First, let me say good afternoon and thanks to each of you for joining us today for a presentation of the results from the baseline study of the Ayiti Djanm RFSA implemented by CRS in Haiti. Today's presentation will be led by Tulane University and builds on their extensive experience in designing and conducting evaluations of BHA-funded food security activities, including previous research carried out in Haiti. My name is Tom Spangler, and I work with Save the Children as Activity Director for the IMPEL Associate Award. I'll ask Karina to paste in the chat box a link to a two-page brief that provides a bit more detailed information on IMPEL's activities. Most of you will know that the overall purpose of IMPEL is to conduct both performance and impact evaluations and facilitate knowledge sharing to improve the design and implementation of resilience food security activities, or RFSAs. Today, I'll pass it first to Shailene Collins, Research Assistant Professor in the Department of International Health and Sustainable Development in the School of Public Health and Tropical Medicine, who will then introduce her colleagues on the Tulane research team. They'll be giving an overview of the Ayiti Djanm program and evaluation design and methods used, as well as results from the baseline study. They'll also respond to any questions you may have about the results, but have asked that they be given time to do that after they've completed the presentation. So for anyone who has questions during the presentation, we ask that you use the Q&A function at the bottom of your Zoom screen to enter your questions so that we can efficiently answer as many as possible when the time comes. Finally, today's presentation and Q&A will be recorded, but only for IMPEL and BHA reference, and the recording won't be shared publicly. We thank you again for joining us today, and with that, I'll pass it off to Shailene to get us started.
Thank you so much, Tom. Good afternoon, everyone. Thank you for the introduction. So I'll just go ahead and launch in. So our evaluation team members are on the call today, and the Tulane team is comprised of Dr. Nancy Mock, Paul Hutchinson, Michelle Lacey, Peter Porges, and myself. And our additional evaluation team members include Sarah Truxillo, who provides much of our research support, and EFOS, who is our local research partner in Haiti. And they are also on the call today. So if you have any questions specific to the field work or the methodological approaches specific to data collection, that sort of thing, feel free to put those into the key function. So to get started, we're going to give you a brief background and overview of our baseline evaluation, going through the evaluation design and the methodology, including sampling, the questionnaire that we used, the indicators we were evaluating, and then training and fieldwork, and then presenting some of the results, noting that these are not all of the results, not exhaustive, but these are some that we found to be most interesting for the audience today, and then some brief conclusions on how we plan to move forward. So just to give you a bit of background and overview, I'm going to pass it over to Peter, who can speak a little bit to the APD project and the food security context. Peter.
Great, thank you. So just to give a very quick background, there's more details in the report, so I know I'm just getting it's a very short summary of the project, but this RFSA is being implemented by the CRS-led consortium. Some of the key interventions include cash transfers, or MPCA, food vouchers, care groups, farmer learning communities, youth entrepreneurship and leadership, VSLAs or SILCs. It's started in late 2021, had its first year of R&I, and then started implementing activities. And it's a 5-year project, so slated to end in late 2026. And I'll just note right here that it's important to note that several of the activities had begun prior to the survey that we're discussing today. So it's important to keep in mind as we're looking at these results. The overall purpose of the impact evaluation is to measure the impact of the cash transfers or the food vouchers, as well as the care group interventions to reduce food security among targeted households and to determine possible attribution to the changes in key outcome indicators. Just quick food security context. This is the IPC map, the projection for August 2023 to February 2024. So at the time of the survey, all areas of the Sud and Nordest departments where the survey was taking place were classified as phase 3 of the IPC acute food insecurity phase classification. Continued increased physical insecurity have forced major internal displacements and disrupted markets, products, and there's also been some rainfall deficits in parts of the country that have impacted rural livelihoods.
So launching into design and methodological approach, we really centered this evaluation around 2 central research questions. So the first was if vouchers alone improved key outcomes, including diet quality, food security, and nutrition among participant households relative to households that were not receiving the vouchers. And the second was if integrated care groups layered with vouchers improved outcomes among direct participant households compared to households receiving vouchers only and households not receiving RFSA interventions. And I'm going to turn it over to Paul to discuss our methodology.
Okay, thank you, Shalene, Peter, and Tom. So data collection for the evaluation comes from 2 surveys, or will come from 2 surveys. So the baseline, obviously, is the one we're talking about today, and then an inline in about 3-4 years' time, household surveys. In terms of analytical methods that we're going to use to compare the different treatment groups relative to a comparison or control group, we're going to use a fuzzy regression discontinuity design. I think we've talked about that extensively in the protocol. And this is tied to the vulnerability scores calculated by the program, and it's going to be used for evaluating arm 1. I'll talk about that in the next slide. We'll also use a combination of differences models. We're following the same households over time. So that'll allow us to use certain analytical methods with some degree of weighted adjustments based on the likelihood of being in the treatment group or some other means of weighting the different households, different observations across the treatment and control groups. We'll have 2 intervention arms, as Shalene was referring to. The first arm 1, will be vouchers with or without MPCA. Arm 2, care groups with or without vouchers, or care groups with vouchers, and then 1 control arm that receives neither vouchers nor participates in the care groups. Next slide. Okay, so this just another depiction of the various study arms. And the number of households that were in the sampling frame, not all of the households that were surveyed, across the various arms. So note that in households in arm 1 have vulnerability scores from the CRS database. And we use this for the fuzzy regression discontinuity design. The idea being that households around a cutoff point in vulnerability are going to be very similar. Okay, so some will be above, some will be below the cutoff point for participation, but right around that cutoff point, they should be fairly similar, and we could treat them almost as if they were random. And so that's going to be the basis of comparison for arm 1 relative to our control arm. Arm 2 are largely drawn from those households who are participating in the care groups, or are drawn from those participating in the care groups, but by and large do not have vulnerability scores, and hence we can't use them for evaluating. We can't use the regression discontinuity design for evaluating them. So as I said, probably using differences modeling and various matching methods. Next slide. Okay, so as I said, the sample frame includes 19,427 households, poor households in the CRS database. We selected 3,200, or roughly 3,200 households with vulnerability scores. Some of them were in the control group, some of them are in the treatment group, and roughly 800 from the care group participants. We didn't necessarily sample completely randomly within each of these groups. There were some tweaks to make sure that we had representation from each of the communes, and some tweaks to make sure that we had sufficient statistical power within each arm. Next slide. So the overall sample consisted of about 4,000 households, 4,002 households. Arm 1 contained 1,480 households with vouchers, with or without cash transfers. Arm 2 had 931 households, 800 with vulnerabilities without vulnerability scores, and 131 with vulnerability scores, which is not a sufficient number to include them in the fuzzy RDD design. And then our control group had 1,591, sorry, the comparison group. Next slide.
So I will ask Peter to come back to present on the questionnaire, training and fieldwork sections.
Great, thanks. So the household questionnaire just quickly included the following BHA, more of the standard modules, although we had some contextual modifications, so household roster, wash, dwelling, food security, and we'll talk about the different indicators we use for food security there, child nutrition, women's nutrition, gender cash, the consumption expenditure modules for the poverty indicators, and then the resilience modules. And we did use the ones that were adapted to be collected just from households and not from community questionnaires. So we made a few adaptations to that. So with the training, in Haiti, insecurity was really limiting travel between the northern and southern data collection areas. And so passing through Port-au-Prince was very difficult or impossible. We had, with EFOS, our local research partner, had gone through a few options of transporting enumerators by plane or helicopter. But we finally, after a few, after making some attempts to figure out what the best way to move forward with that, we came up with a hybrid training format. So we had concurrent training being conducted in 2 locations. These were being led by EFOS. With survey coordinators, or EFOS had survey coordinators physically present each of the location, and then they were each contributing to various sessions of the training. And then the 2-lane team, and then we also had CRS staff for some of the sessions, were all participating remotely. And EFOS was using a satellite internet connection, which ensured consistent connection on Teams. So we could always see each other. They had the cameras in the front of the rooms, so we could see the participants in each area. And then whoever was presenting could project whatever they were working on. And it went really well. It was really great. I think it's a lot thanks to EFOS. They were quite organized. But it worked quite well. It was very efficient. So the field work conducted by 59 enumerators with 15 field supervisors. We also call them team leaders. The data collection took place between 18 September and 24 October. The majority was collected a little bit earlier than that end date, but some of it we extended about 10 days or so because of some challenges with some cholera outbreaks and insecurity in a few of the areas that we were working in. APD assisted, staff assisted the field teams in locating the households. We had a very low refusal rate. It was less than 1%, but we did have a little over 10% of the sample that required us to use replacement households. Part of that came from absence of the household, multiple visits, and nobody was home. A few of them were inability to locate the household from the information that we had available. And then some of them, because of cholera-affected households or cholera-affected areas and security, we chose to send the teams to conduct interviews with different households in nearby areas because of that.
Great, thank you,
Next
Peter.
slide.
And so moving into results, I'm going to leave it with you to present demographics.
Great. So just some demographics. And we're always the terminology for male and female headed households has been updated. I have still trouble getting myself updated, so forgive me if I'm misusing it. We did follow the standard guidelines. Households headed by both male and female, 72% of the households headed by only a female, 20%, male headed 7.7%. The average household, the mean household size was 5.8, which is in line with what we would expect. A little over half of the households had 1 or more children under 5. We did see some differences between the study arms. The vouchers only group had a significantly lower percent of households headed by both a male and a female than the comparison group. So 67, 74. It was significant. It wasn't a huge difference, but it was a significant difference. And also significantly higher female only headed households, 23% than the comparison group. And then the vouchers and the care group, that study arm, those households had significantly higher percent of households with one or more children under 5 than the comparison group or the vouchers only group. Now that's expected because the care groups are primarily focusing on children under 5. So that significant difference is something that we would expect. Food security. So we used the food consumption score, and then we also used, instead of the FIES, which we had not had the best, we didn't feel it functioned terribly well in the Haiti context. We had used the household hunger scale before, and so we used that as the other experiential indicator of food security. And we saw high prevalences of hunger and of poor and borderline food consumption score. 87.8% of households had moderate and severe hunger, 77% had poor or borderline food consumption score. We did triangulate this with a 2022 survey, food security survey done by SANSA, the National Food Security Coordination. And they reported 51% nationally had, I didn't make this clear here, but had a poor and borderline food consumption score. And some of their rural strata, they had high as 90% of households with a poor or borderline food consumption score. So looking at that, our findings were in line with what one might expect. There was only one significant difference observed in the prevalences of poor plus borderline, in the significant differences between the study arms and in these food security indicators, and that was in the prevalence of poor and borderline food consumption score, which was significantly lower for the vouchers and care groups compared to both the vouchers only, and then more importantly, compared to the comparison group. It wasn't a large difference, but it was significant. We'll talk about this a little bit more later on. I think Michelle's going to talk about it some too when she talks about the resilience indices. But this, because of the way that the sampling happened, we're not surprised that this vouchers and care group study arm is often a little bit different and appears to often be a little bit better off. So that's you'll see that thread coming through.
Thank you, Peter. Paul, over to you for the poverty indicators.
Okay, so we calculated poverty indicators based on the estimation of consumption aggregates as outlined in Deaton and others and the USAID BHA indicator handbook. Severe poverty was determined as the Haitian equivalent of the $2.15 purchasing power parity severe poverty line, which in Haitian currency was 112.9. So you can see quite a few of the households, in fact, 85% of the households in our sample were below this severe poverty line. This is considerably more than the World Bank estimate of poverty of 34%, but keep in mind our sample is a sample of very poor individuals. That's why they're being targeted. It's also higher than a national poverty survey that was conducted in 2012. So overall, our estimates of, as I said, the prevalence of poverty, about 85% of the sample, the depth of poverty, the gap between the severe poverty line and what households report as the per capita consumption, about 57.1%. And as I said, daily per capita expenditures were 113 in Haitian currency. Within our sample, we found that the vouchers and ICG arm households tended to be slightly better off than the other households. They had a lower poverty prevalence, 80.7% versus the 85 overall. They had shallower poverty depth of 54% relative to 57.1, and higher daily expenditures, 125 relative to 113. Next.
Thank you. And so for our WASH indicators, overall, about 3% of households had access to basic drinking water. And so just to refresh you on the criteria for basic drinking water service, that's an improved source, so protected from external contamination, less than 30 minutes round trip from home, with availability of at least 20 liters per day year round, and having water every day in the past 2 weeks. About 26.7% of households considered themselves to be water insecure using this novel HWICE4, which the results of which are on the right-hand side and broken down by question that comprise the HWICE4. And 39.7% of households had correct use of household water treatment. About 23% had access to basic sanitation services. 37.3% practiced open defecation. Fewer than 10% had access to soap and water at a hand washing station on premise in their household. And there were significantly higher hand washing stations with soap water in the vouchers and ICG arm, and significantly higher access to basic sanitation than the comparison group. Regarding child nutrition and feeding practices, over half of households in the sample had one or more children under 5, and children had a low mean dietary diversity score overall. And I'll go through what those different categories and how what the consumption data looked like so that you can have a sense of that. And diarrhea was common and was not typically treated with oral rehydration therapy, but there were no significant differences observed between study arms. So looking at child diet, there was overall very low consumption of eggs and flesh foods, and the diet was primarily comprised of grains, roots, and tubers. For women's diet and family planning, women of reproductive age overall also had a low mean dietary diversity score, with only about 8% meeting the minimum dietary diversity. And then moving into family planning, nearly all women had a knowledge of 3 or more modern family planning methods, but only over half of women of reproductive age in a union reported using any of them in the past year, and there were no significant differences by study arm. So women's diet was similar in some ways to child diet, which is not surprising, but overall very low consumption of eggs, low consumption of nuts and seeds, dairy and other vegetables, and then moderate consumption of pulses with grains, roots, and tubers comprising the majority of the diet. And so now moving into livelihoods.
Yeah. So we used this was part of the resilience modules and the standard list of livelihoods that BHA recommends to use. We did add the manufacturer sale of charcoal in here, since it's a very common, it was actually EFOS's suggestion because they knew it was a very common livelihood in some of these areas. So 56.6% of households reported practicing, and this should be greater than two livelihoods. Reliance on agriculture by own production, business, or labor, the most commonly reported. Non-agricultural labor was also very common. There were some significant differences between the vouchers and care group study arm and the comparison study arm. The lower livestock production, fattening, and sales in that voucher and care group than the comparison. Lower agricultural labor, a higher non-agricultural labor, and higher salaried work. And again, most of these are indicating that voucher plus infant care group may have some more slightly better off households. Government program was significantly lower in the comparison group than voucher group or the vouchers and care group study arms. Now, the question is government programs such as safety net food or cash assistance. Now, in our experience, not everyone receiving that lists it at a livelihood, but this is exactly what we would expect since these households had received vouchers or were part of this voucher plus infant care group study arm. And so we would expect that to be more prevalent in those groups. Yeah. And then sort of the abbreviated title here, but natural resource management and agricultural financial services. So we didn't have a full agriculture module in this survey. So we asked households that reported that the production and sale of agriculture goods was one of their livelihoods. So just under half of the households, they were the ones that were then asked about if they've used any of these improved agricultural practices in the past year. And of those households that practice agriculture, 85.8 of them employed at least one or more of these practices. And I should add, this is the list of improved agricultural practices that was provided to us and defined by the project itself. And 22% of households practicing agriculture reported having used financial services in the past 12 months. So that was savings, agriculture credit, and agriculture insurance. I put here no important differences noted between study groups. There was some slightly lower prevalences of use in the of some of the agricultural practices in the voucher and care group study arm. And one of the questions that came back to us was like, why do you think that might be? So we're looking into that a little bit to see what could be, but I don't have an answer for it yet. Yeah. Next slide.
Thank you, Peter. I'm going to invite Michelle to talk on the resilience slides.
All right. Good afternoon, everyone. We had all of the standard capacity indices, as well as a shock exposure index, percentage of households with diversified livelihoods. Now, this was defined not just as two or more of any kind of livelihood, but two different livelihood sources. So either farm, non-farm, and the third was livestock. So three different types of livelihood. So 55% of households reported that. We'll talk more about the shocks and stresses in a little bit, and the local government responsiveness. As you can see, pretty low level of participation in group-based savings or microfinance, but again, those were the group-based rather than formal. And then we had the social capital index. Can move on. Right. So when we compared across the groups, we did see that for the adaptive and transformative capacity, there were some higher values in the voucher and ICG group. I'll try to provide a little more context for that a little later. Also somewhat improved ability to recover from shocks and stressors according to the index. Now, the local government responsiveness, I think, is a very important one to think about, because this was defined as the ability of security or police to reach their home within an hour or less. So this seems to suggest demographically that the care group households were a little more centrally located, probably a little less dispersed and a little less rural. This makes sense to me, given that a lot of these households were people who, again, someone referred them to these programs. So anything that suggests a little more integration and community, a little more connectivity, is likely to be true for these households. Next. All right. So these are different types of shocks that were reported by the different study arms. And what you can see here, where you see the green, this is where the confidence intervals do not overlap, and they were lower. So the people in the self-selecting, again, the infant care group, they had lower rates of agricultural types of shocks. So fewer issues with erosion, crop disease, crop pests, livestock disease. Now, interestingly, well, one would expect the controls had lower reporting of delay in food assistance, but still the fact that 37% of them did report a delay in food assistance leads one to wonder what exactly is going on there. In principle, these should not be receiving food assistance, at least not by us. They also, can you go back? Also, you'll note that the livestock disease incident for the controls was, I didn't highlight this one, but it was significantly higher than for any of the other groups. That speaks to, they did seem to be the most engaged in agriculture of the three, and maybe the most affected by agricultural related shocks. All right, next. So this is just to give a sense of what this means in practice, right? So when you look at the distributions across the groups, averages say one thing, and then the actual curves say something else. And so what we see is there is a bit of a shift with the green, which are the voucher and plus ICG groups, having slightly less of a shock exposure than the other two. Not too much difference between the controls and the standard voucher only group. Next. Now this one is, I wanted to plot this because this index, as you might imagine, isn't, the mean of this index isn't particularly informative. But what you look at when you see the peaks here is that the red peak above the two is significantly higher than the blue peak, which is significantly higher than the green peak, which suggests that overall the controls have a lower ability to recover than either of the two groups. And again, the voucher group maybe is slightly better, at least in terms of having extremely low scores. There isn't as much of that in the other two groups. Next. All right, so when we look at the absorptive capacity, the components of the absorptive capacity index, pretty low overall. So we see that when you look at the possible range of these values on the right and what we actually saw in terms of informal safety nets, in terms of access to savings, in terms of access to remittances, assets, all of these things, insurance, the only one where we see a reasonably decent value is the availability of humanitarian assistance, which makes sense because obviously they're involved in this study. So this speaks to pretty low capacities across the board for these households. Next. And when you compare the curves, they're pretty consistent. So slightly higher values for the voucher and ICG group, but overall the absorptive capacities are pretty low across the board. So these are all, as we would expect, pretty low income households with not a lot of resources. Okay. So there's a comment that there were other food assistance programs active at this time, which might explain why we see the control group commenting on food availability or assistance. When we get into the bridging social capital, again, most of these things, the adaptive capacity, mostly pretty low, except for education and training. We see that these communities, the education is not particularly poor, at least the way it's being defined here. And as Peter mentioned, the adoption of improved practices isn't awful either. But again, and financial institutions, most of them do have access to, or at least half had access to some sort of formal financial institution. And when you look at the confidence and the aspirations to adapt, those are not terrible. I mean, these are not completely downtrodden people who are not willing to, they're not completely fatalistic. What is included in asset ownership? Could you go back for a sec? So this was a pretty limited questionnaire. Some basic assets that we've seen are present in Haiti in the past. So things like telephones, cell phones, furniture, very, very basic assets here. And then land, a few things like that. So again, if they're scoring very low on this, it means that they basically have a bed, not much there. So I see a question. Yeah, so the asset ownership was pretty low. And then the other question we can get into a little later. Okay, go on. So when we compare the adaptive capacity, we do see a bit of a divide here. The ICG group has a peak that is a bit to the right of the others. And we see that, again, this isn't quite as skewed. So this is kind of a measure of the skewness, right? So if all is going well, you expect your population to be fairly symmetrical. And what we see here is that this is not awful, right? These are potentially adaptable communities, but they're not, they're low resourced. Next. All right, when we get into the transformative components, there are some important things going on here. So communal natural resources is extremely low in these communities. Infrastructure availability is pretty low. Livestock wasn't applicable to a lot of people, but it's there. The social capital is pretty low across the board. Almost no one's involved in any kind of collective action, which is generally defined as sort of working with your community to get projects done and things like that. We don't have a lot of that going on. Social cohesion is pretty poor. So we don't see a lot of community level resources here that are really helping people in the event of trying to make a fundamental change in their environments. Next. And here's where we really see a huge difference, right? So again, with the voucher and the infant care group, they are much, much better situated. They seem to be in communities that are better integrated. They're more involved in things. They seem to be more plugged in short than the other groups. The control and the regular voucher arms are almost identical as far as this goes. So just to summarize the key differences with this voucher group, with the infant care group, they have higher availability of services, they have more infrastructure, they have more access to financial institutions, they're less involved in agriculture, and they are more, again, they have more, they're more centrally located, or at least they're located more in greater proximity to government and security institutions. So those were the key takeaways there with respect to
Thank you.
results.
Thank you, Michelle. So Peter, I will turn it over to you for conclusions and next steps.
So the few thoughts on this, the data quality and field work. We found that overall the survey data has been to be quite good quality, and the results generally align with the expected findings for the populations surveyed. There were few to no errors found in the questionnaire, which we were very happy about. There were a few in the programming that we all shared responsibility for that were only uncovered during the analysis, and we can correct those during the end-line survey. They affected one or two of the indicators, but they weren't widespread. The collaboration with EFOS was highly successful. We've worked with them before. We were so happy to work with them again. They were really able to rapidly adapt to changes in training and the training and the field work. And that really, of course, contributed to the high quality training and field supervision. I really don't want to underemphasize their role because of, we can't travel there. They're the ones in the country. They're the ones doing, all of the work. So we're very, very impressed and thankful for their collaboration. The hybrid enumerator training, again, the in-person remote participation was really successful, and we thought that could be used as a model for other contexts where training's hired in that way. The study arm balance that that we've been talking about throughout. As you've seen, there's some differences between the study arms that will need to be considered during the analysis at the end line, particularly among this voucher and care group study arm. They're often better off. I think that does speak also, Paul and Michelle, correct me if I'm wrong, but to the fact that this, the sample design using the FRDD was quite successful in balancing those two groups. And then where we couldn't use this FRDD, we had a sort of less balanced group with this voucher and infant care group because we couldn't balance them by that. There are other reasons too. They weren't amongst the poorest of the poor to begin with. Several of the many of the households that joined that were receiving vouchers and because they had joined the care groups. So that the differences there aren't surprising to us, and we'll be accounting for those through multiple regression analysis and or propensity weighting in the final impact evaluation. And then looking ahead, just a few thoughts for, as we're looking towards the end line. We want to work closely with CRS APD to update information on the sampled households with data from the APD targeting database as much as possible, so we can have that information and activities the households have participated in during the life of the project. And so the careful analysis of participation data collected in the survey and the data from the database, APD database, will be important to describe and maybe even redefine some of the study arm classifications as needed. And the end-line data analysis, as I was saying, would need to have a carefully constructed model to account for the differences in some of those key indicators observed between the groups that we were discussing. And then during the survey pre-planning stage of the end-line survey, and this was just a thought, I think it's just a mine really, but it may be useful to conduct a small assessment to estimate the percent of households from the baseline that the teams will be able to relocate. We don't expect attrition to be very high, but it's hard to say now. Internal and external migration in Haiti is higher than it has been in previous years. So it's hard to predict what it's going to be like. We expect to be able to maintain a reasonable sample size, but that pre-assessment could help us identify if there's a higher than expected attrition. We'll have time to reassess the sampling strategy accordingly. That may also be able to be done by looking at the APD databases and seeing what changes there are in those over the life of the project. And then, you know, again, I can't speak highly enough of EFOS, and we plan on using the same local research group, EFOS, and then ideally the same coordinators and team leaders, enumerators, wherever possible in the end line, so that we can ensure the consistency and quality of the data. And then finally, the next steps, we're going to be incorporating the feedback. We received feedback last week from both BHA and CRS, and we'll be revising that into the draft of the report and getting that back to BHA in early February, and we'll be finalizing that. The end-line quantitative survey will be taking place in 2026. I put this very tentatively because it hasn't been, you know, formally discussed or anything, but we would ideally do it around the same time of year to avoid seasonal differences. So I put in September tentatively here. And then the final evaluation, just so you're aware, will also have a small this should say qualitative, excuse me, a small qualitative component, as well as a cost analysis component. And that will be in 2026. So yeah.
Thank you, Peter. So now we would like to open it up for discussion and a Q&A session. So I know we do have one question in the chat from Joe Grange. Will the difference in hi Joe, by the way, will the difference approach take care of the differences in responsiveness to shock between the groups? And Paul, would you like to respond with what you just with your
yeah, sorry, Joe. I was typing, and well, I guess I wasn't fast enough in typing. Certainly, that's something that we would like to consider. I think it's something that we would definitely look at in sensitivity analysis. I think there are different ways that we could look at controlling for different responsiveness, perhaps somehow using that responsiveness and the weights that we use for the difference, weighting the difference in different estimates. But largely, we would like to try different means or methods of estimating the treatment effects, and then just seeing if they differ much based on the different controls. Obviously, if we get the same results regardless of what we do with responsiveness, then then we can be pretty happy. I don't know, Michelle, do you want to add anything?
Yeah, just to add, I mean, the fact that we do have repeated measures on the same households means that each household can kind of serve as its own control. So even at the individual level, we can account for these things. So, once we are, we can model the differences in a pairwise way as well, so that we can see whether or not there are significant shifts at the individual level, rather than having to pull everybody together. So that will help with this as well. That was one of the values of being able to do this design, where we can go back to the same households and see whether things have shifted at the individual household level.
Thank you. Tom, and I know that IMPEL has been working in the background collecting questions. We just got another question in the chat. Would you like to lead how we're planning to address this?
Yeah, I was trying to track questions in the Q&A, but I see this question from Jean-Paul in the chat, if that's one you're referring to. Jean-Paul, I can read it out, or you can ask it yourself. We've got plenty of time. Feel free to come off mute and pose this question to the Tulane team yourself.
Thanks. So my concern here is about the diff and diff, right? The fuzzy discontinuity design. We can look at it separately, but in this case, right? It seems that I'm understanding from your data that one of the groups is is quite different from the others, right? So, I mean, that to me raises questions about whether they were on similar trends to start with, right? Because if one group has, for example, tighter social capital, it, in my mind, they would not be on the same trend, right? So I guess the basic, and then, so that's my interpretation. But the basic question is, you know, I know you're going to do some matching and so on, but it remains that, you know, this relies a lot on the common trend assumption, and so if you were able to collect any data to verify that.
So I don't believe we have any data pre-trend data to use. That being said, you know, there's a lot of newer literature on different diff models that relax some of the assumptions about the importance of the parallel trends assumption. You know, I think if you look at like the Callaway and Santa Ana paper that came out a few years ago, and some of the papers related to that, they do a good bit about relaxing some of those assumptions. The doubly robust estimators, I think we can have consistent results. We can get a consistent estimate if we are able to, let's see, if either the propensity score model or the outcome models are correctly specified. So it is an issue. Obviously, we don't have a randomized control trial, so we can't control for all observables and unobservables across the different groups. They are different, and you know, we're obviously going to wonder whether any differences that we see are due to the program versus the differences in the people participating in the different programs. But I think there are things that we can do even without having much information on pre-trend, you know, the trends multiple periods prior to the onset of the treatment. Does that help?
I would say too, I mean, it really depends on what it is that we're hoping to see. I mean, if we see that, so what my understanding at least is what happened with this infant care group is that people were referred to the infant care group, and when they joined the infant care group, they were automatically made eligible for vouchers. So some of these individuals may have been individuals that would have been selected based on the survey, and others may not have been. And so again, we are going to see that there will be a lot more variability among these households, and there will also be a lot less, there may be less need in some capacities. But if the question is, do these households benefit? We will be able to see, you know, whether or not some combination of being part of these care groups and vouchers offers some benefit to those households. Whether the magnitude of their benefit is greater than the households that only participate in the vouchers, that may be difficult to suss out, because again, they are coming from different, there are a lot of other factors to consider. We can look at maybe some subsets of those where we see that, but I think we, again, the fact that we are doing repeated measures on the same households means that we'll be able to get to know the characteristics of these households in greater detail than we might normally be able to. And so we can try to figure out what actually, we can learn to some extent what factors actually do seem to drive benefits. So are these households, by virtue of being more connected in their communities and having advantage of these other factors, does this help them more? Or does this mean that nothing really changes for them? So, you know, these are all things that we can learn.
Thanks, but I do think we have to be careful to not mix up sort of a longitudinal type of, you know, approach where we're comparing the households with themselves, and an impact evaluation where we want to compare them to a comparison group. But
no, I agree. I agree with that very
thanks.
much. Yeah.
Okay, thank you very much for those responses to the questions, and please keep questions coming as you have them. We have a couple new questions in the Q&A tab, and I'm gonna take one first that may be tangentially related. It's from Julius Ross, who asks maybe a silly question, but will the FRDD also analyze longitudinal data on the same households?
So I think that's what we were just discussing. That is the design. So as much as possible, we're hoping that we'll be able to follow up with the exact same households that we interviewed in this first round. There will of course be some attrition and there may need to be some substitution, but what's nice about the repeated household design is that you can get a pretty good signal out of a fairly small sample. And so even if we do have some loss, we will hopefully have a good enough subset. In our prior Haiti study, we learned quite a bit about just 200 households where we had repeated measures. So hopefully that will be, we'll have well more than that here. So it should be a fairly powerful design.
Excellent. Thank you very much, Michelle. Paul, if you had anything to add, please do chime in. Otherwise, a next question is by Harlan Hale, and it's related to wash indicators. He notes that they're quite poor, and acknowledging that the RFSA doesn't have wash directly in its scope. Still, he asks what might be the implications or thoughts of researchers on those relatively poor wash indicators.
I can take this one. So we know that food insecurity and water insecurity are almost syndemic in every context, right? Where you have water insecurity, you have food insecurity. We are seeing relatively low rates of perceived water insecurity. And so despite the fact of low access to basic water sources, when you really dig into those data, most people had access to an improved water source. So they actually did have access to water. It's just didn't meet the criteria for the basic water access criteria that BHA has laid out. And so I think the major limiting factor was the capacity to access water every single day and the capacity to retrieve 20 liters of water. And so there may be some misinterpretation of that question. If, households have a stand tap, next to their property or, within a short distance away, they may not necessarily need to retrieve 20 liters of water because they're just, washing and doing things at the water source. So I think that's sort of one piece. Aside from that, I think it's really important to make these wash considerations that households didn't really have soap in their households to wash their hands or hand washing stations, and so of course those are concerns, but they don't really fall under the purview of the evaluation. And so we will be looking at some of the wash indicators to determine some of the impacts that having low access to hand washing stations, water, open defecation, that sort of thing have on some of these other outcomes of interest. But it's not really within the purview of the evaluation. It was sort of especially the water insecurity portion was something additional that we were interested in.
Okay, thank you very much, Aileen. I hope that's helpful. And just to note that there have been some follow-up questions related to the methodology, and I see, Paul, you've already offered some references or resources there. And Jean-Paul noting that conversation may need to continue offline, but thank you for that. I see just a question that's come in from Beth Carroll at CRS. And she asks, in terms of locating households or having a large enough sample, would we consider adding a third group in the final evaluation of vouchers plus cohort 2 care groups, since the current cohort of care group finishes their 2-year cycle in March of this year? I'll let anyone at Tulane take that question who feels ready.
I'll throw it out, and anybody else please interject. I mean, it wasn't an original plan to, but it's a possibility. But then it changes our sort of evaluation plan and cost of the surveys and things like that. So Nancy.
Yeah, let me throw in, I mean, the cost of the survey is a big one, obviously. And there are important questions about the sustainability of effects in care groups and such that will be answered by following these same households. So I think that it's important to do so and not switch. Cost will determine whether we could expand the sample on the end line, if that makes sense to do.
Beth, I see you have your hand raised, and Stacy, I see yours as well. I don't know who was first. Beth, please go ahead since we're discussing your question.
Oh, thank you. I guess first, I also want to really thank Tulane for this great presentation and EPOS for the data collection. I know it was not easy in the current situation. I guess I definitely apologize for kind of throwing that big question out there, and I understand cost implications are a big component of that. But I also reusing the term baseline quite a bit and inline quite a bit, and given that this data collection happened, just a few months before this care group cohort finished, it's 2-year cycle, and given that given that these participants did mainly receive the cash voucher activity and the vouchers not long before this, it just, since it's not truly going to be a baseline end line, it seems like it could be interesting to have another metric in that conversation to see if if it makes a difference between if it's the sustained voucher support, if it's the care group support, if it's the question of sustainability, if it's the active care group support, if those benefits fall off once care group activities end. Yeah, sorry, I apologize because I don't know the right terminology to explain that in a meal context.
Thoughts, Tulane team, or something that you want to just chew on a bit more and consider?
Yeah, I think we should continue that conversation offline. I think it's an interesting point, and there's so much going on here that yeah, we'll continue the discussion.
Yeah, thank you, Nancy. And I do see your note here, Peter, just acknowledging the great contribution CRS has made to helping get this design and evaluation off the ground. It's been really, really critical. Stacy, let's go to you next. You have your hand raised, and then AB, I'm not sure who that is, but see that your hand is raised. We'll take your question after Stacy's.
Thanks, Tom. And this is somewhat related to Beth's point. I was wondering if maybe later this fiscal year, if we could have a conversation with Tulane. I'm not sure what their LOE is like on this, just to and maybe share with them our current database, and just make sure that what we're going to give them in 2026 is going to be what they need to help keep attrition down, but also to get a sense of the dosage information. Obviously, we want you guys to cross-check at Endline, the dosage information that we have. But to Beth's point, we have a lot of interventions, but some of them are going to be phasing out. Some of them, because they're self-selecting, we're not necessarily tracking, they're meant to self-scale. But we would want to share with you guys, what interventions we know they participated in and when, in addition to just contact information to keep the attrition down. So I was wondering if we could meet later this fiscal year, just kind of make sure that we have our information in such a way that's going to be helpful to you guys. And if not, it still gives us, a good year and a half to correct that so that our database is in such a condition to really help it Endline. Over.
Absolutely.
Yes. Yeah, please let me say, because this is very, what you're saying has been something we've been dreaming of for a while, which is to be able to link the databases that you collect and to get a good feel for the dosage of different interventions and the exposure intensity and so forth. So if we can do that, it would be a first, and it's really, it would be very welcomed on our side.
Yeah, and just to add to that, everything that Nancy said, we gathered additional contact information as one of our final questions from every household, more phone numbers and a description of how they found the house and things like that, the location. But anytime, please just reach out to us and let us know, and we can work on that as you described. That would be great.
Yeah, excellent. Thank you. Yes, AV, you had your hand raised, been patient. Please go ahead.
No, thank you so much for the opportunity, and thank you for the presentation. I had 3 quick points. One, just the access to improved water. It's my understanding you guys had that at 57%. The mission just did a wash baseline for the first time in about a decade, and we actually and the wash baseline covered more areas, but the wash baseline for rural Haiti was at about 40%, and you guys had it at 57%. So I thought it might be helpful, and I don't know who to send it to, but just to kind of share with you guys our wash baseline, just to see if you guys were defining improved drinking water maybe differently than what the mission was. So that was point number one. Point number two is just, and this is probably my confusion, it was my understanding that you guys defined $2 a day, which is the kind of baseline or floor for people extremely impoverished. And it was my understanding that you guys put that at like $112 or 112 Haitian gourd. And so I was just a little confused, and I'm sure this is my error, because $1 is worth, well, I mean, depending on the moment, but just say 120 gourd. So I would think that number would be 240 rather than the number you guys were using, which was kind of in the low 100s. So that's my second point, which is a question. And then the third one, when looking at the issue of farmers, it looked like drought was a big issue for a large majority of the farmers. But then also people were saying that they did not have water insecurity. But obviously the drought is an issue of not having enough water. So just wondering, understanding that water insecurity probably doesn't cover farming, right? It just covers kind of water and drinking and sanitation. Wondering if you have any other type of water indicator that could be used with reference to farming other than the drought. Thanks so much.
Sure, thank you for that. Just 2 quick points on the wash. I put my email address in the chat if you would like to share the wash data with us, so we can look. I would love to set up a meeting too, just to discuss how the baseline water insecurity survey went, or the water survey went. So in terms of the water insecurity questionnaire that we used the reduced HWISE 4. So the HWISE household water insecurity experiences. I was in the initial team that developed and validated that scale. And so it does we use the short form version versus the longer form version is 12 questions and does have more complete information on water for things aside from just drinking and use. And so, if we were to use the HWISE 12, so that the full scale in the inline, I think we would capture more nuance. Whereas, the HWISE 4 was typically for, drinking water, worrying about not having enough water to drink, that sort of thing. And, it really doesn't comprehensively capture some of these other areas, but does speak to concerns about direct water consumption. Though, sometimes people worry about their direct water consumption and don't worry about crops and vice versa, depending on the context. So I think that merits, kind of circling back. And we were really trying to have a shortened list of questions. We didn't want to have too much burden in our survey, so we didn't include the full HWISE scale, but I think it's something that we could consider in the inline. However, we did validate the scale in Haiti initially. It was for a separate project, and I do have the results from that validation if that's something you'd like to see. We could discuss that offline.
Yeah, and I would also add that where people were reporting drought, that's, in the shock and stressor category. So that really only applies to people who do farm and who also, maybe don't have any access to irrigation or anything like that. So, which is pretty common. We've seen that in the past. So given that only about half of the households are farmers, those that are farming and lack any irrigation, yeah, their inability to irrigate their land doesn't necessarily fall into the same category as their ability to have sufficient water for their own personal use. So they are really capturing different things. I think there were some questions about access to communal agricultural water supply. That is something that is very lacking, and that showed up in some of the other resilience components as well. Whether or not they have access to water for farming is a whole different problem.
But very important, and I think point taken. We Shalene and some of us at Tulane are also working on coping strategies for water insecurity, and this bigger issue of water is the driver of all kinds of insecurity, right? So so sometimes the personal use one is just a bit too limited, especially for populations like this one.
And we are hoping, I think the coping strategies index should be available for piloting by the time we do the inline survey. So that's something that we could also hope to incorporate. Of course, as our partners are interested in it, and if it's still an interesting question at that time.
So regarding the purchasing of the severe poverty line and conversion to the gourd, I used information from the Haitian Institute of Statistics and Information, IHSI, and so prices were very volatile last year. Inflation was quite high. I don't know how well what we calculated for September of last year may not be valid anymore. I haven't been following the inflation rates lately, but we calculated a purchasing power parity based on what the Haitian Ministry of Economy and Finance or whatever published, and then adjusted for the exact month of the survey. So I think it's the best that we could do. The actual value, I think we calculated the severe poverty line as 188, and then our households on average had a value of 113.
And Paul, I just want to, this is actually for my understanding too, I think, but it's when you say the $2.15 purchasing power parity, you don't just multiply that by the conversion rate at the time to get the Haitian gourd one. You're using like how many gourds do you need to buy $2.15 worth of things in somewhere else or whatever, the same thing, right? I mean, if I'm not explaining it well, so yeah.
No, yeah, exactly. It's not based on any sort of official exchange rate or anything like that. It's based on a basket of goods, and the value that the Ministry of Economy and Finance assigns to that basket of goods based on prices and international comparison. A lot of the information came from the World Bank, so I tend to use their stuff because I don't know that there's that much that's better out there. At least it's official.
No, I think it's all correct. It was just I think he was explaining like if it's 125 gourds to the dollar, why isn't it 225 or 250? But it's not a simple just conversion based on the exchange rates. It's using all that data you're talking about.
No, we don't use the exchange rate at all. It's evaluation of a basket of goods and service, or basket of goods.
Okay, thank you very much, Paul. And to your point, calculated within a very dynamic economic context for sure. So AB, I hope that provides some insight into your excellent questions. Those are really useful. If anyone else has questions or points they'd like to raise with the research team, now's the time to do it. We've got plenty of time, and these are all very helpful. Any other questions? And you don't have to type it. Feel free to raise your hand and just chime in. Okay, I don't want to cut this off. Yeah, go ahead, AB.
Yeah, thanks. And it's thanks everyone. And just I didn't introduce myself, so I failed at that. So it's Adam Bushy from USAID. Yeah, so sorry. Been with aid 16 years and part of the Haiti mission team. But yeah, so just to follow up, thank you so much for the $2 basket. That was new information to me. So thank you for explaining that. And then regarding the water discussion, I really appreciated that. I think there's a real interest mission-wide from BHA's programming to our ag programming to our water programming on, dealing with drought, dealing with just all aspects of water. So we talked about whether there'd be interest in adding some of those water indicators. I don't know if financing is available or if that's not an issue or what the issue was, but you were talking about if there is interest, and I'm interested, although I am just one vote of many. So thank you for offering that as a potential, delving a little bit deeper into that. That's all I had.
That's excellent.
Thank you, Adam.
Yeah, and I'm sure your interest is noted. Seems as though it's shared by the Tulane team. Harlan, I see you've got your hand raised. Please feel free to ask your question. It is no longer. Harlan, maybe your question has been answered already. If not, and you want to ask it, please do. I'll invite others to pose any questions you might have as well.
Yeah, sorry, I hit the wrong button and stuff happened.
All right.
I'm not so good with these things. First, I want to thank you guys for this the work you've done and the incredible information. And I would like to follow up offline and a bit more about EFOS and your sort of remote hybrid training. I think we have, you mentioned that could be a model for others, and I can see other programs where we may want to learn from that. So I'd like to follow up with you all offline on that as well. Thanks. Over.
That's great. And if you write any one of us at Tulane, we can put you directly in contact with EFOS as well. I mean, that goes for anybody else with any other questions, because we definitely want to promote them as well. But we'd be happy to have a meeting and talk more about that.
Yeah, Harlan, you bring up a really interesting point from the perspective of it was not just this hybrid training, but it was real-time sort of data quality checking and to a certain extent real-time, basic analysis, because the system that was established between EFOS and Tulane allowed us to upload and download data as it was coming in from the field. So we actually looked pretty carefully at data early on. We missed a few things, but we also found some issues that needed to be corrected. So it's actually it's more than just, in fact, hybrid training. It's, I think, a real opportunity to improve real-time data and also to improve quality through real-time monitoring of quality.
And I would say we couldn't have done that without our research partners' collaboration. I mean, they were really responsive to all of our questions. If we noticed, any aberrant data collection, in the survey, any issues with the survey, they immediately corrected it. I think their flexibility was really appreciated.
Well, thanks in advance to Tulane for your willingness to talk with Harlan about that. Yeah, we definitely would like to learn from your experience. Any other questions? I don't see them coming now. I don't want to cut it off early, but this is not your last chance. We can end for today and give you a few minutes back. If you think of any questions, you know who to reach out to. Obviously, either the BHA team or directly to Tulane through IMPEL. So with that, I'll thank everyone. Most importantly, the Tulane research team on doing an excellent job in sharing these results. We know it hasn't been easy context in which to do this, but this has been quite helpful. So thanks everyone for joining, and enjoy the rest of your day.